Self-isolation can follow the rules. Staying inside can save lives. In addition to staying home when sick or in quarantine, physical distancing is also important. This means staying 2 meters or about a hockey stick length apart at all times. Having said that, I know that there are some situations where this may not be possible, such as carpooling. If you are not under mandatory self-isolation, you will not be fined for traveling in your vehicle with your family or carpooling with coworkers. However, if you are feeling unwell, you must stay home. This is also not the time for people to go out to their summer cottages or seasonal villages to self-isolate.
Why?
Services and supports are limited in these communities. Please stay in your own home and away from others if you are feeling unwell. Each of us must continue to do everything we can to flatten the curve and keep our friends and family healthy. While Albertans must practice physical distancing, it is important to remain socially connected. Text or call an old friend you haven't spoken to in a while. Video chat with a family member or loved one. We will need to find new ways to connect with each other while being physically separated. It is through helping and looking out for one another that we will overcome COVID-19. I call on all Albertans to treat each other with kindness, acceptance, and respect. Look out for each other. We are all in this together. Thank you, and I'll be happy to take questions.
Dr. Hinshaw, if you could, what's the total number of confirmed cases again? And could you please just run through the five fatalities again with details on where and ages? Thank you.
For sure. So the total number I didn't say the total number.
Canada just put a lockdown where you can't leave your home, period, guys, except for what she said.
Total number. And then with respect to the 5 deaths that we've had, and again, please, I want to convey my deepest sympathies to the families because each death is a tragedy, and to have 5 in one day is...
And the other number was 695.
So there was a female in her 70s in Calgary, as well as a female in her 50s in Calgary. In Edmonton, there were 2 males in their 80s and a male in his 30s in the North Zone.
And any new recovered cases or?
There are, but that didn't make it into my speaking notes. We're at
94.
94.
Of course.
Excellent. Operator, we'll go to the phone and then we'll come back to the room. Operator, could you pass through the next question?
Sure. The first question is from Kevin Mimic of CTV. Please go ahead.
Hi there. I do have a question for Dr. Joffe. Doctor, I'm wondering about long-term care facility workers. As I understand it, many of them work at several different locations. Is that still happening, or has that sort of workflow been suspended?
Thank you for the question. Let me begin by saying that this is a difficult day for all of us who work in healthcare. As we've heard, there have been several deaths related to COVID-19, and I too would like to express my sympathies and those of all of us who work with Alberta Health Services to the families, friends, and loved ones of those who have passed away. So thank you again for that question. We have had intensive discussions about exactly that issue over the last several days. So the issue is of individuals who might work in multiple care homes, and we have had to consider what the options may be and whether restricting individuals to working in just one facility is feasible, because if we do that, we might impact the care that individuals in other facilities might receive. So as of today, we have looked intensively again at this question, and the decision currently is that we cannot restrict individuals from working in multiple settings. However, if anyone has any symptoms whatsoever, we expect them to stay home and self-isolate. There will be screening of staff as they enter facilities to ensure that they are presenting to work healthy and ready to work. Again, this discussion that we had today will continue, and we will be reviewing this on an ongoing basis.
They are idiots because they're going to spread
Operator,
it,
could you pass through the next
guys.
question?
I'm not kidding.
Yes, the next
That,
question
that
is
was
from
stupid.
Emma Graney of the Globe and Mail. Please go ahead.
Yeah, g'day guys. 5 deaths in 24 hours. I'm curious as to how much of a surprise that comes to you both, given the trends that we've seen in Alberta so far and where these cases are in terms of care homes.
So certainly we have always known with rise in cases that we will have more severe cases just as a percentage, and with that come deaths. While it's not surprising that these would happen, again, each of these individuals had a life that mattered and people who loved them, and so I think that's the hard part is having so many all in one day. We know also with the number of cases that we've seen in we've had a couple of outbreaks in seniors facilities, that these are very vulnerable people who live in these facilities, and so we are watching closely to see what happens there. And my colleagues, the medical officers of health and the public health teams and the teams at those facilities on the front lines are working very hard to control the outbreak. So I think, again, it's a very somber reminder, not that we needed a reminder. Again, I think it's been really clear that every case is a case that we'd like to avoid, but it just underlines the importance of the actions that all of us need to take to prevent further spread.
Excellent. And my apologies, I provided Dr. Inshaw with incorrect information. There have been 690 cases to date. 690. Operator, could you patch through the next question, please?
The next question is from Kieran Levitt of the Toronto Star. Please go ahead.
Thanks for taking my question. I just wanted to get your comments about something that we saw in the news today. Vice reported about a couple who decided it would be a good idea to go up north into a small community, reportedly to get away from the pandemic. I think it, maybe it goes without saying, but I'm just wondering, being that Edmonton in particular is so close to the north, can you just kind of give a rundown of why that may not be a good idea and what kind of the challenges are up north, just in case people who are thinking of maybe doing something similar can kind of have that context?
Sure. So I think if people are thinking about leaving wherever it is that they usually live, going somewhere else to either for say a 2-week period if they need to be on self-isolation, or if they're thinking they would maybe move somewhere else temporarily to get away from, say, an urban center. I think one of the challenges is realizing that wherever it is, if someone's leaving from a larger center to go to a smaller one, there are often less services available in smaller centers, whether that's healthcare services or other services. And so the more people that do go into those smaller centers, the more likely those centers are to be overwhelmed with the infrastructure they have to support just those who are typically resident in that area. I think the other thing to consider, I know that my colleagues in Northwest Territories, Nunavut and Yukon are very concerned about having people coming from places like Alberta, BC, Ontario, where we know we're having local transmission, that they're concerned about having cases imported into northern and more remote areas where, again, the healthcare services are somewhat limited and just not robust. It makes it much more difficult to get access, especially if somebody does need intensive care. And then there's also that chance, if leaving from a place, again, while we're working on determining the exact extent of the spread, we do know that we do have some local transmission here in Edmonton. So if they're leaving from a place like Edmonton or Calgary and going somewhere
With that, what that means, I'm just cutting it off because it's the same old line and dance, is no bugging out, period, guys. And if you're going to bug out, you take your own responsibility to go out there in the sticks and survive. We all know that that's how it goes when you bug out. Now, I'm not saying there's a catch-22 on taking it with you and out and spreading it. I understand. But if you're going to go out in the boonies and self-isolate, remember I told you guys a while back it would be too late to bug out? We're there. Now they're not allowing. You can't go to the forest. You can't go to your own places. And she's just rattling on right now. Um, the thing that got me, and if I don't get it on this video, I'll go back later and get it, is at the start. You're not allowed to leave your house. You're allowed to go in stairwells. Bad.
I'm just curious what you will be watching for this week and how today's deaths will affect that. Thank you. So
How deaths will
I think
affect
one
future.
of the critical things we're watching is our numbers. With the switch in our testing strategy, we're really focused on understanding where in our communities are we seeing local transmission and how we can put a stop to that. I'll also be watching the vulnerable populations, so long-term care facilities in particular. We've put a number of new measures in place over the last week, and I'll be talking with seniors home operators and with my colleagues on the front lines in public health to make sure that it's really clear what expectations we have for how we're going to be protecting those individuals living in those facilities.
But
So
yet they're
to
allowing
see how those
people
measures are
to go
implemented.
from one facility to
I
another
think
to
those are
work.
really the two critical pieces, and
These idiots
ultimately
don't know
how these
what the
deaths
hell they're
impact
doing.
what we're watching for. Again, I think it really is just a reminder that every person who's infected with this virus, every person who's exposed to it, whatever the course of the illness that they have, this is impacting so many lives. And I think, you know, personally, I would say that it's a reminder of how big a time we're all living through together, how extraordinary this time is. And I know that the measures we're taking are very hard for many people. And the impact of this virus is very hard on many people. And it's just a reminder of that human story within this global crisis, that there's so many human stories within that, stories both of hope and of challenge. And so I think today is certainly a day we're thinking of those challenges, but also over the coming week needing to look for those stories of hope as well.
Excellent. We'll go to the phone and come back for final questions in the room. Operator, could you patch to the next question, please?
Thank you. Yes, Michael King, Global News. Please go ahead. Michael, if you're muted, could you unmute your phone, please?
Thanks. Yeah, I'm here now. Some concerned families and parents at the Mackenzie Town Continuing Care Center are increasingly worried about that outbreak. Some feel that provincial authorities should step in for more staff and resources to get everyone tested and get the real scope of the outbreak there. What's your response to these family members? Do you feel that adequate steps are being taken to contain the outbreak? And do you feel it's necessary to step in to provide extra resources?
So I've been in regular communication with my colleagues, the medical officers of health in the zone, who are working on the front lines to support facilities like Mackenzie Town to respond to outbreaks. And so I would really trust their judgment. These are professionals who are skilled in public health and epidemiology and the prevention of infection and the measures that they're working with the facility to implement. So if in their judgment they're believing more resources are needed, I would be very happy to talk to them and hear what kinds of additional supports are required. But again, I have great faith in my colleagues at the front lines and their ability to provide support. It's a difficult, tremendously difficult situation, and so many people are affected, both those who live in, work in, or have family members or loved ones in that facility. And so I would just say that it's my intention that certainly everything be done to prevent any further spread. And again, I'm really confident in my colleagues at the front lines and their supports that they're providing to that facility.
Operator, could you patch for the next question, please?
I want what she's on, double dose Xanax.
Yes, Jennifer Lee, CBC News. Please go ahead.
Hi, Dr. Hinshaw. I'm wondering, last week you mentioned that these confirmed cases were really just the tip of the iceberg in terms of what's out there. And I wonder, we've had 5 more deaths in one day. Can you give us a sense of how much more widespread you think this is than the numbers are actually showing in terms of what the projections are out there for case numbers? Could you speak to that a little bit?
Sure. So We are working, I know we've spoken before about modeling data, knowing that some other provinces have released their modeling data. And so we are hoping to be able to make that available publicly by the end of this week. What our modelers have been telling me is that, well, I suppose from a very basic premise that of the cases that we are finding that we don't know what the link is. So again, we have, I believe as of today, there are 65 of those cases. So each of those 65, there's at least one other in the community where they would have acquired it from. And again, the estimation from our modelers is that we probably have an average of about 2 cases per those ones that we're finding without the EpiLink. So that would, by definition, bring us up about an extra 120 more, kind of under the water, so to speak. But again, that's an estimate. We don't know for sure. And what we do know is that every single person can make a difference. And again, that goes back to what we talked about. We will never be able to test every Albertan who has symptoms of a cold, runny nose, sore throat. We will not be able to test the entire population. So really, independent of the total numbers that we have, we need everyone to pitch in and do the right thing. Stay home if you're sick, and make sure that you support others to do the right thing as well.
Excellent. Operator, could you patch through one more question from the phone?
Rick Dolphin, the Western Standard, please go ahead.
Yeah, good afternoon. I'm wondering, I'm presuming that postmortems are being done on the people who have died, and I'm wondering what we are learning about this disease and how specifically it kills people.
So I will have to take that question away and get back to you, because typically with respect to when a postmortem
They're not.
Exam is done, it's required if there's no known cause of death. In cases where someone's known to be infected with COVID-19, especially where they're in hospital, where they're being treated, and it's really clear what symptoms they're having, then a postmortem or an autopsy would not be required on those individuals. So I would have to take that away and find out if we have actually been doing postmortems on some of these cases. But what we do know from just watching people's clinical progression through their illness is that typically people have significant difficulty breathing, so acute respiratory distress, where their lungs, there's inflammation and their lungs can't exchange oxygen very well anymore. And despite the efforts to support them with methods like ventilator use, they simply cannot survive. And again, it's a mechanism where the lungs really just don't function well anymore. But we can take the question away about autopsies and get back to you.
Excellent. We're going to come back to the room. Reminders, one question each. Back to you.
Dr. Hinshaw, I'm just curious, the 94 people who have recovered so far, when you say recovered, does that mean they're no longer showing symptoms, or they've been tested and they're no longer testing positive at all?
So when this epidemic first started, when we had our first few cases, we were following a protocol of testing to confirm that people no longer had the virus in their system. But we've shifted away from that, partly because we do have a limited number of lab tests. And what we know from studies that have been done in other places is that even if you can detect virus in, say, a nose swab, that doesn't mean that that virus is actually alive, so to speak, or capable of infecting another person. So we're currently using a protocol where if somebody, especially those who have mild symptoms, if it's 10 days from the start of their symptoms and they don't have any symptoms anymore, so they've recovered and 10 days have passed, that they're no longer considered to be infectious and they're considered to have recovered. So that's how we're getting those numbers.
Keep in mind it can come around twice.
Hi, Dr. Hinshaw. I was just wondering, I know that obviously it's an ongoing situation, but have you had any chance to look at the last 2-3 weeks, however long we've been in this now, and see if there's any lessons learned from how we've approached different restrictions and techniques? I was just wondering if you had a chance of doing that yet.
So that's a good question. And I think certainly I do my best to reflect on lessons learned, and especially looking at other jurisdictions and having the chance to talk with colleagues across the country gives that opportunity for reflection. I think that it is still a little early to be able to kind of look back and determine those lessons learned. I think that what's consistent and what I hear from my colleagues across the country is the sense that acting early, so taking steps that are necessary to prevent spread when there's a first indication that something has shifted, is important. And I think that we've done that. And also that question of how do we balance all of the needs of people in the society. So preventing the spread, but at the same time recognizing we do need to have supply chains to get groceries to people. You know, we have to keep some of those essential services running. And so I think ultimately I would say that we have across the country been able to learn from each other and to be able to see that when one jurisdiction is considering something, if they're a little bit ahead on the curve, we can learn from that. I think the final thing I would say is that our ability of our local labs to expand testing and our ability of our local public health teams to expand contact tracing ability, I think is something that is an incredible cornerstone of our response. And so again, we'd kind of celebrate all the work that's gone into that, as I think that will prove to be one of the most important things that we've done all along, is making sure that we had as much capacity as possible in those areas.
Thank you all for coming. Dr. Inshaw will provide another update in person tomorrow afternoon. Additional information is available on alberta.ca/COVID-19.
A few things to take in. I'm going to try to get the first part of this. It didn't get to it in time. If not, I'll run it in a video after this as soon as it reloads on their system. Because what she came out and said to start with was alarming, to say the least. Talking about people must stay in their homes. You can't go out your stairwells. You, excuse me, can't do this, can't do that. I mean, some serious lockdown BS coming out of their mouths right now. She did make a few exceptions as the thing went on. I put to you that these people in the U.S. over there are so out of their depth, they don't even know what they're doing or how to handle this. Because this, again, bioweapon, you got to remember when we talk about engineered diseases, they're engineered to do exactly what this is doing, guys. And they're made to adapt and spread and change and mutate. And that's another thing. We're not even through this thing could be very well, and it has mutated already. It could be mutating again in ways that only mad scientists know, guys. I mean, literally. So with that, I do want to bring you, I mean, the lockdown thing is starting to concern me. I mean, I understand both sides. You know, I just do. But I just, you know, this is America. And what they're talking is damn close to martial law. Let's not kid ourselves. Okay, when you hear the first part of this video, you're going to go, OMG. Believe me. Secondary, I touched a little on it for a minute. Sorry, guys. Was the bugging out. I talked to everybody weeks ago about if you're going to bug out, get the hell out, you know. And I think officially about give or take a week and a half or two ago, I kind of was like, you need to go if you're going to go. And then the last week, I definitely said it as things looked uglier. And now I'm afraid between the states and the United States putting up borders and stuff, I'm honestly worried that you won't be able to get to no bug out spots. It's almost too late. So if you have a bug out spot and you can get there, if you can get there and you want to go and you take the responsibility on what could happen out there, then go. And the responsibility to stay away from the people out there and not bring it to them. So that means if you're a prepper or survivalist and you've got a bug out place set to go for exactly this situation. No, it's not nukes. No, it's not other things. This is the one. This is how it... remember we spun the wheel? meteors, earthquakes, da 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 da, you know, nukes, EMP, or contagion virus. That's what we got. And this is it. This is real. So again, this is my place. I'm not going anywhere. This is where I am. A lot of people aren't. A lot of people can't too, guys. So I understand that too. So if you can't, you have to make the best you can. Hopefully you've been out, Team 99, getting some things while you can. That's why I've been pushing our governors to get some money to you guys and some extra food stamps like 2 weeks ago or 3 weeks ago. You know, because you guys could have went out and got stuff while you're still able to get out. And that's a major concern with them getting off their asses now and getting some monies on cards. They can issue those to everybody. Yes, they should have already had them in the mail to you guys. Everybody. 500 minimal cash, 500 minimal food. You could have went out and just stocked some stuff. Now, they almost seem to not want to be doing this. And I know the other thing is, oh, they would go buy the stuff. There wouldn't be nothing left like the toilet paper. You know what? If you're going to do these kind of things, you have to do it. Otherwise, we need to see trucks that are military going to each community and dumping off cartloads of groceries per home, period. There is stockpiles, guys. Don't let them kid you. However, another concern is, and we've talked to truckers at different places, and I have some connections that come from the main hubs back east, is when those things go down or the sickness starts, you might not get your supplies. So we're at the point to where it's no longer, it never was a game, but that you can't be messing around is what I'm saying. So at first I said, don't go spend your monies. Again, I can't give you advice. You have to do what you want. Any of my advice is illusion of illusion. We use the Fair Use Act, and nothing is real until it is. And knocking at your door like this, or like they may be doing if you already bugged out and you came from New York, from what I've heard. So I'm going to try to find this real quick. If I can't, we're going to end the video, and I'll start another one so you can hear the beginning of this, because I am very deeply concerned with what I heard her say. And this is not fear-mongering. It's nothing of the sort, guys. I just am very, very, very concerned. Let's see if they've reloaded this. It says it ended 3 minutes ago, so have they reloaded it is the question. We'll see. This, I don't know if this is it or not, guys. I'm going to try, and then I'm going to hang up and start again. Oh, this is there. They have not reloaded it yet, guys, so I can't get it for you, unfortunately. Yeah. All right. I'll bring it to you next so you can hear the confirmation of what I just told you was for real that they were saying. Till then, be safe, and healthcare sucks.